I hope that we were able to provide you with a smooth and comfortable experience during your joint replacement. Now that we have that behind us, first of all, welcome home. Now, let's talk about what we can do moving forward from here to ensure that you remain on a good trajectory to have the recovery that you're hoping for following your surgery. Obviously, you're not moving around very well right now and you're going to need help around your house. This is why it's so essential that you not be alone in the days following your joint replacement. It varies how long you will need this help for, largely dependent on how well you were functioning before the surgery and what your overall mobility status is. But you should expect that the people who are staying in your house with you will need to handle a lot of the things like household chores while you're getting back on your feet following your surgery. If possible, it's ideal for you to avoid going up and down stairs inside your house and stay on one level of the house so that we can minimize the amount of stair climbing that you're having to do. It's unavoidable in many situations that you're going to have to go up and down stairs to get into the house, but we want you to stay on a single level once you're inside the house, if at all possible. The 5 most important things you can do to ensure we don't have a complication following your joint replacement are: number 1, do not fall down. Number 2, do not fall down. Number 3, do not fall down. Number 4, don't fall down. And number 5, please do not fall down. It is hugely important. And the best thing that we can do to ensure you don't have falls is have you use ambulatory aids as you're transitioning back to walking. This obviously starts with a walker, but I don't want you to graduate to a cane until you feel like your balance is 100%, where you are not going to be at risk of falling down with that cane. The same thing goes as you graduate from a cane to nothing. Don't stop using that cane until you feel completely steady on your feet without it. We are much better off having you use those ambulatory aids longer than necessary than have you try to push things, get off of them before you're quite ready, and have a fall, because those falls are what can lead to some of the real serious complications we see following a joint replacement. Following your knee replacement, anytime that you're laying down, I want you to have something underneath your heel rather than underneath your knee. You can see this in the cartoon off to the side here. When things are underneath your knee, they leave your knee slightly bent, and that can make it hard for you to straighten it all the way out if we have it like that consistently in the first few weeks following surgery. So, when you're laying down in bed at night, or if you're laying down throughout the day, I want you to make sure that something is underneath your heel so that gravity is pushing your knee down and letting it rest perfectly straight. There are a few different types of dressings that get used for my joint replacements, but all of them have one thing in common: they're waterproof. What this means is you are fine to begin showering immediately after the surgery, as long as that dressing maintains a good seal and water is not allowed to seep underneath it. If we lose the seal in any portion of the dressing and water begins to seep underneath it, it needs to be removed right away, and you need to call our clinic so that we can replace it with a new one. In some cases, I use a dressing called Dermabond Prineo, and this is a mesh that's then coated in glue and allowed to dry directly on your skin. Here you can see what this looks like when it's put on, as well as what it looks like after the surgery. You may have this underneath your dressing. If you do, you may notice that the skin around the incision is especially stiff because of this mesh. Don't worry about that, because this will be taken off eventually, and then you'll go back to having just your normal skin after I've removed this mesh from protecting the skin around the incision. In wounds that I feel are at higher risk of breaking down, I'll use the device you see here, which is called a PICO. This is a small battery-powered suction device that hooks up to the dressing and applies light suction to it. If the green light is blinking in the OK area, that means that you have suction being applied to the dressing. Eventually, the batteries will die and you'll see the low battery indicator turn on. When this happens, just remove the hose from the dressing, and now the dressing functions like any other dressing would. Keep it on until you see us in clinic, and we'll remove the dressing itself at that point. You are going to have a lot of swelling in your leg following your joint replacement. As your body heals following the surgery, there is a massive increase in the amount of blood flow that goes to the surgical site. This carries with it a lot of fluid to the surgical site, and this leaks out into the tissues surrounding the area. Gravity then causes this to drain downwards anytime you're standing up, so you'll find that even your feet end up being swollen. You should not be alarmed by this. However, there are a few signs which are shown here which might indicate to us that you may be forming a blood clot in your leg. If you are, the best thing to do is call our clinic at the number which will be shown on the next slide so that we can make a determination about whether or not you should go and get an ultrasound. If we do find a blood clot, it's nothing to be terribly alarmed by. We would likely just change the medications that you're on for anticoagulation as we move forward from there. If you have concerns that something has gone wrong with your joint replacement, please call our clinic first. We know your case the best and will be able to provide you the most detailed and up-to-date instructions about what to do. If you are truly having an emergency, we want to be a part of that conversation so that A, we know what's going on with you, and B, we can direct you to get the appropriate level of care that you need. We want to keep close eyes on you as much as we possibly can, and the best way we can do that is if we're in the loop on everything that's going on with you. In this study out of Germany, patients reported how much pain they were having multiple times per day for the first 30 days following a knee replacement. And this graph shows us one really important thing. It gets better every single day. Whatever pain you're having today, you'll have less pain tomorrow. Whatever pain you're having tomorrow, you'll have less pain the day after that. So I hope you can find some solace if you're feeling uncomfortable right now in knowing that this is temporary. We're doing this for a long-term outcome. We're trying to get back some activity that you lost because of your arthritis. And if we can go through this short-term temporary pain in exchange for that long-term gain, I hope that it'll be worth it for you. But I hope you also know that this isn't going to last forever. This will get better. Here's what we can do to help with that pain in your initial recovery period following your surgery. The biggest thing is to get up and move around. This does a few things. First, it helps decrease the swelling in the surgical site and wake up the muscles that were disturbed by the surgery. But also, it helps you psychologically realize that you don't need to be afraid of this. Your new joint can handle whatever you're going to throw at it, and I want you to feel comfortable using it. In terms of medications, I want you taking the anti-inflammatories unless there's a compelling medical reason, such as kidney issues or stomach issues, that restrict you from taking them. I also want you taking Tylenol, and I want you taking the Tylenol and the anti-inflammatories whether or not you're experiencing pain. I want you to elevate the leg in order to minimize swelling, and I also want you to try and use as few opioids as possible. As we discussed preoperatively, I really don't think opioids are good for your overall health. You may need them as a rescue medication in this initial period, but I don't want you using them proactively. I only want you to take them if you've already had your anti-inflammatories and your Tylenol and you've iced and elevated and are still experiencing pain. The fewer opioids you use, the better your recovery will be. Sleeping can be a challenge following a knee replacement. In this study, you can see that at 30 days after surgery, patients were sleeping significantly less than they were either preoperatively or at 2 months following the surgery. And this is a reflection of what I see in my patients as well. If we can get you sleeping, it can also really help you get over the hump with your pain. There are a few things that we can do to try and optimize your sleep hygiene, and I'm going to include here a video which goes through those. These are general tips for sleeping for every single day of your life, but they're particularly important when we're battling the discomfort that you have from your knee replacement in the initial month following surgery.
One of the main goals of sleep hygiene is to learn to associate being in bed with being asleep. And so the first rule of sleep hygiene is to only use your bedroom for sleeping and intimacy. You want to train your mind to associate the bedroom, and especially your bed, with sleeping and nothing else. Because most people who sleep poorly associate being in bed with lying awake, not being able to fall asleep. And we really want to train our bodies to associate being in bed with sleeping, because that makes it much more likely that we'll fall asleep when we go to bed. So don't bring your laptop or phone to bed. Don't study or work in your bed. Don't have a long problem-solving session with your partner in bed. And don't laze around in bed once you wake up. If it helps you to fall asleep, you can read or watch TV in bed for up to 30 minutes before you go to sleep, but no longer than this. If you like to read or watch TV for longer than half an hour to help you wind down at night, then start off somewhere else, in the living room, on the couch, and then only move into your bedroom and bed once you're ready to fall asleep. And only go to bed once you're already feeling drowsy. Otherwise, you'll just lie there in bed, unable to sleep. And then, if you've been in bed for more than 20 to 30 minutes without having fallen asleep, lying in bed any longer is unlikely to bring on sleep anytime soon. You're just teaching your body to associate being in bed with lying awake, rather than falling asleep. So after 20 to 30 minutes of being in bed, unable to sleep, get up and move to a different room and do something relaxing for 20 to 30 minutes. Like reading a book, or listening to some quiet music, or doing a relaxation exercise like the one I linked to in the description. And then return to your bed only once you're feeling sleepy. And try to keep your bedroom dark, quiet, and relatively cool. Our bodies cool down at night as we prepare for sleep, so if we keep our bedrooms too warm, it interferes with this process. And most people find they sleep best at a room temperature in the mid to high 60s. And sleeping well isn't just about what happens once you go to bed. The hours leading up are important as well. Try to stay off your computer or phone for 30 minutes to an hour before bed, and use a blue light filter on any devices you can as bedtime approaches. And don't eat a big meal, drink alcohol or caffeine close to your bedtime. And nicotine is a stimulant, so avoid smoking right before bed. And try to have a nighttime routine that involves some relaxation before you get into bed. Doing some yoga or meditation, or taking a bath, or just reading or watching TV. Or even cleaning up the kitchen if you find that relaxing. We all need something to help us unwind before bed. If you're working right up until bedtime, or dwelling on things that went on during the day, or worrying about tomorrow when you get into bed, you're probably not going to be able to quiet your mind enough to fall asleep. And now we're going to look at sleep scheduling and how that can help us sleep better. One of the most important things we can do to promote good sleep is to keep a regular sleep schedule. Our bodies rely on a consistent 24-hour routine, or circadian rhythm, to regulate our sleep-wake cycle. Our bodies get used to going to bed at a certain time and waking up at a certain time. That's why if we get up at the same time every day, we often wake up just before our alarm goes off. Our body knows that it's time to wake up. It doesn't need an alarm to tell it. The more we can stay consistent and let our bodies get into the habit of knowing it's time to go to sleep and it's time to wake up, the better our sleep will be. And the less regular our sleep schedule is, the less we can rely on our body's internal clock to help us sleep, and the more we start fighting against it. And so keeping a consistent sleep schedule is one of the best things you can do for your sleep. And that's one of the things that makes sleeping so difficult for shift workers or new parents, whose sleep schedules are constantly getting disrupted, or when we travel across time zones or experience the effects of daylight savings time. And it's important to try to maintain the same sleep schedule even on weekends. If you're so tired at the end of the week that you need to sleep in, try to limit it to no more than half an hour. If you're sleeping in a few extra hours on the weekend, when you try to get back to your regular routine on Sunday night, you're probably going to find it hard to fall asleep. And difficulty sleeping Sunday night is one of the reasons we can be so cranky on Monday mornings. And if you need to take a nap, these are fine earlier in the day, but try to keep them to under 45 minutes. Otherwise, it can disrupt your sleep at night. And having a nap later in the day makes it more difficult to get to sleep at night. So a nap in the morning or after lunch should be fine. But a nap after work or after dinner can make it harder to fall asleep when you go to bed.
It's very common for patients to ask me when they're cleared to drive following a joint replacement. And there are studies which provide some rough averages, but I'll never tell you that you're cleared to drive. You're going to have to make that decision for yourself based on your safety. And there are a few things that are key to making sure that you're safe to be on the road. Number one, if you're taking opioids at all, you should not be driving. Number two, if your brake response time has not returned to normal, then you should not be driving either. And what I mean by this is, if you find yourself in an emergency situation on the road and have to slam on the brakes, we need to ensure that you're going to be able to do that quickly. The best way to answer this question is for you to go to an abandoned parking lot and practice. If you don't feel like you can safely slam on the brakes in an emergency, then that tells us it's not time for you to be back on the road yet. One activity that you may be unsure when you should return to and are probably uncomfortable to ask me about is sex. This infographic from the American Academy of Hip and Knee Surgeons shows multiple different positions that can be utilized safely following a hip or knee replacement for either partner. And this provides you with some guidance on how to return to that, although obviously you're going to have to judge the timing of that based on your recovery, your pain levels, and what you feel comfortable with. The last thing I want to leave you with today is the recovery curve for a total knee replacement that I showed you in an earlier video. Remember, this is going to take time to get all the way to where you want to be. I want to walk with you every step of that journey, but I'm confident that at the end of it, you'll be in a better place than where you started, and we'll be glad we walked through this together. That's all, folks. This is the end of this video series. I really hope that this information was helpful for you as you work through this process, and I also hope that you keep these links available so that you can refer back to them if there's areas that you're unclear about as you continue moving forward in your recovery. All of the videos have timestamps so that you can see where specific content is within them and click into them to just view that portion of the video that you're trying to remember. As we move forward from here, I want to continue checking in with you on a regular basis in my clinic. That will allow me to do two things. Number one, I can check on your recovery and make sure that everything's going according to plan. And then number two, I can be your cheerleader. What I want to do is reassure you that you're moving along well and encourage you to keep working. Every day we want you to get a little bit better, and if you stack up those days and get a little bit better on each of them, they'll add up to big improvements. Eventually, those improvements will be big enough that you'll start hitting the milestones that motivated you to do the surgery in the first place. That's really what matters. I want you to get back to those things that drove you to go through this process in the first place. And when you do, I want to celebrate them with you. I've got this email address up here on the screen, and all this email does is serve to forward photos from you straight to a frame that I keep on my wall that rolls through a slideshow of my patients. I want my patients doing things they couldn't do before surgery. And when you do that, I want to share that victory with you. So please, 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 if you're doing something that you're excited about, that your hip or knee replacement has allowed you to do, send me a picture at this email so that I can celebrate that victory with you. Again, thank you for your trust in me. Thank you for working with me through this process, and we'll keep moving forward from here together.